Good afternoon, everybody. Thank you for joining us today for our presentation specifically for payers. I'm Adam Rossi from the Communication and Outreach Unit at the Workers' Compensation Board, and today I'll share the latest updates on several initiatives that are helping to make the board better for payers and the workers' compensation system overall. Joining me today to assist with your questions are James Wessel from our Office of Operations and Programs, as well as Stephanie Zufali, the board's Director of Regulatory Affairs. We ask that you please keep your phone lines muted, as we will be using the chat feature to receive your questions today at the end of the presentation. You may enter your questions throughout the presentation in the chat box located on the right side of your screen. Just please be sure to use the drop-down to send your questions to all panelists. We will answer as many of your questions as we can, but if you have questions that we don't get to today, or if you think of something after the session ends, we will be providing you with resources at the end of the presentation. A recorded version of this webinar, as well as a copy of the slide deck, will also be provided to you at a later date. Please be sure you are subscribed to our email updates so that you are notified when those are available. And if you are not subscribed to email updates, we will go over that at the end of today's presentation as well. So let's go ahead and get started. Today, we will be providing you with updates on several board initiatives that you as payers should be aware of. We recognize there's been a lot of activity and communications from the board on various initiatives over the past several months, so we wanted to bring it all together for you and give you an opportunity to ask questions. In today's session, we'll be covering several recent updates from the board, including Onboard, the board's new and improved business information system, followed by updates on the New York Medical Treatment Guidelines, or MTGs. We also want to go over some things you should know regarding the implementation of the CMS 1500 form, which will be effective on July 1st. Finally, we will review important information about workers' compensation as it pertains to COVID-19. We will then leave time at the end of the presentation for your questions. Let's start with an update on Onboard Limited Release, the first phase of the board's new and improved business information system. The initial release of Onboard was implemented in phases from March 7th, 2022 through May 2nd of 2022, beginning with submission of prior authorization requests, or PARs, for medication, which are known in the system as medication PARs. Today, providers and payers are using Onboard to request and review prior authorization for medication, durable medical equipment, and treatment and testing. And we have hundreds of these prior authorization requests successfully flowing through the system each day. To date, over 35,000 payers and reviewers have signed up for access, and nearly 100,000 PARs have been processed. We are truly working to take the comp out of complicated. If you have not yet registered for Onboard, we strongly encourage you to do so as soon as possible. Payers will need to log into the medical portal to access Onboard. Every user will need their own login credentials. A single login cannot be provided to an organization to be used by all users who are part of that organization. There is no limit to the number of users an organization can have. The claim administrator, such as the insurer, a self-insured entity, or a third-party administrator access, is granted using organizational profiles based on eClaims trading partner information. The payer is ultimately responsible for the review of PARs. A payer may designate a medical review organization to review their PARs. However, the medical review organization must first complete the online Medical Review Organization medical portal registration. Pharmacy benefit managers, or PBMs, may be designated by the payer to review Level 1 medication PARs. The PBM must complete the online PBM medical portal registration process prior to a payer designating them as the reviewer. This chart on your screen labels what submissions each provider type can make. For example, All provider types listed can submit a request for decision on unpaid medical bills, Form HP 1.0. Non-MTGs under or equal to $1,000 PARs and non-MTGs over $1,000 PARs as well. And you can view this chart on the payer overview page at wcb.ny.gov/onboard. Once a PAR is submitted, you, the payer, have a set number of days to respond. Response requirements vary for certain PAR types. Responses for MTG confirmation are required within 8 business days. MTG variants and MTG special services responses are required within 15 calendar days, but the response time is extended to 30 days if an IME is requested. Non-MTG over $1,000 responses are required within 30 calendar days. Non-MTG under or equal to $1,000 responses are required within 8 business days. And medication and durable medical equipment responses are due within 4 calendar days. You can also view this chart on the payer overview page at wcb.ny.gov/onboard. In December of 2010, the board implemented legislatively mandated medical treatment guidelines, or MTGs, that fundamentally changed the delivery of healthcare to injured workers. The MTGs initially included 4 evidence-based guidelines for the treatment of injuries involving the neck, back, shoulder, and knee. These became the mandatory standard of care for dates of service on or after December 1st of 2010. On March 1st of 2013, the carpal tunnel syndrome MTG and updated versions of the then existing MTGs, including a new maintenance care program, were adopted. The non-acute pain MTG, as well as updated versions of the existing MTGs, were implemented for dates of treatment on or after December 15th of 2014. The following MTGs are effective for treatment as of May 2nd of 2022. Knee injury, mid and low back injury, neck injury, non-acute pain in shoulder, ankle and foot disorders, elbow injuries, hand, wrist, and forearm injuries, including carpal tunnel syndrome, hip and groin disorders, occupational interstitial lung disease, occupational or work-related asthma, post-traumatic stress disorder and acute stress disorder, work-related depression and depressive disorders, eye disorders, traumatic brain injury, and complex regional pain syndrome. The board has online training available on the MTGs for both medical and non-medical professionals. Payers should complete the non-CME versions of each training. To access the trainings, visit the board's website at wcb.ny.gov and navigate to the Healthcare Provider section in the middle of the homepage. Select the Medical Treatment Guidelines link. From there, you can select the training link on the right side of the page. Next, we'll take a look at the board's transition to the CMS 1500 form. To reduce the administrative burden on board-authorized healthcare providers, the board made the strategic decision to consolidate and eliminate certain medical billing forms and transition to using the CMS 1500 form, which is the universal claim form used by medical providers to bill the Centers for Medicare and Medicaid Services, known as CMS, as well as health insurers. Beginning July 1st of 2022, payers are required to use the new Notice of Treatment Issue/Disputed Bill, which is Form C8.1B, and the Notice to Healthcare Provider and Injured Worker of a Carrier's Refusal to Pay All or a portion of a medical bill due to valuation objections, which is Form C8.4, with applicable claims adjustment reason codes, or CARCs, to object to medical bills. Phase 3 will require payers to use the specific CARCs on their provider EOBs or EORs when objecting to payment of a medical bill, whether the bills are received through an XML submission partner or on paper. The new forms and CARCs will be available to view on the board's website in July of 2022, and while use of them is mandatory, the board will be extending a grace period through September 19th of 2022. After a review of Forms C8.1 and C8.4, the board determined it would no longer require inclusion of an injured worker's full 9-digit Social Security number as of June 16th of 2021. Instead, only the last 4 digits of the Social Security number should be included on the form. Payers completing the paper or online version of these forms should provide only the last 4 digits of the injured worker's Social Security number. Providers must submit the CMS 1500 form. We encourage providers to start using CMS 1500 now. Electronic submission through an XML submission partner is strongly encouraged, though not currently required. When mandatory submission of the CMS 1500 form begins, use of current medical billing reports, including the doctor's initial report, which is the Form C4, and the doctor's progress report, Form C4.2, will be discontinued. A full listing of the discontinued forms will be discussed later in this presentation. Providers must also prominently report the injured worker's temporary impairment percentage, their work status, and causal relationship of the injury at the top of the CMS 1500 form medical narrative. The board has developed a medical narrative report template that can be used to create the medical narrative report that accompanies provider submissions of the CMS 1500 form. Providers should use this report when submitting the CMS 1500 form. The template includes the 3 mandatory elements to include with most narratives: the patient's work status, causal relationship of the injury to the patient's work activities, and temporary impairment percentage. These elements are important for you to note as payers. A medical narrative report may be found legally defective if these elements are missing. Please note, the CMS 1500 initiative does not change anything related to a payer's assessment of causal relationship. It merely requires causal relationship to be reported prominently in the medical narrative. A PDF of the report can be found at wcb.ny.gov/CMS-1500-requirements under the Medical Narrative Requirements section. We urge you to share this template with providers if you notice it is not being used. More information on the CMS 1500 initiative can be found on the board's website at wcb.ny.gov/CMS-1500, or you can email cms1500@wcb.ny.gov with questions. The EOB/EOR is the board's prescribed format for filing an objection or objections to the payment of a medical bill. Insurers must submit an EOB/EOR to their XML submission partner upon adjudication of the associated electronic CMS 1500 medical bills. The EOB/EOR will be forwarded from the XML submission partner back to healthcare providers. Pursuant to 12 NYCRR 325-1.25, payers must identify the objection reasons for non-payment on the EOB/EOR. All legal and valuation objections to payment of a medical bill must be made at the same time and on the same EOB/EOR. Such objections must be made within 45 calendar days of acknowledgement of receipt of the medical bill, whether on paper or digital. The payer should continue to send the board the Notice of Treatment Issue / Disputed Bill Form C8.1 and/or a notice to healthcare provider and injured worker of a carrier's refusal to pay all or a portion of a medical bill due to valuation objections, Form C8.4, along with a copy of the EOB/EOR to object to payment of a bill. Payers must submit Form C8.1B and/or Form C8.4 at the same time to advise the board and the provider why they are objecting to payment of a medical bill. The payer also sends an EOB to the provider explaining why the payment was withheld or reduced. Effective July 2022, there will be a standard set of CARCs for all payers to use for all EOBs, whether electronic or on paper. Payers may use the full set of CARCs and remittance advice remark codes, called RARCs, to further clarify their bill processing. However, at a minimum, the objection reasons on the EOB/EOR should match up with the legal and valuation objections the payer selects on Form C8.1 and Form C8.4. Payers and medical bill reviewers should be starting to work on mapping their adjustment codes to the CARCs set forth by the board. In this example on your screen, CARC 197 would be used when a payer objects to treatment that deviates from the medical treatment guidelines without securing a variance. Once payers and providers are accustomed to using the CARCs, and the board can electronically capture the CARC data directly from the payers, we plan to discontinue both Form C8.1B and Form C8.4. The board released new versions of the C8.1B and C8.4 forms in the spring of 2022. Please note that on the bottom of the Form C8.1, you will see a field for employer name under the certification section. Please be aware that the intent of this field is to capture your company name, not the injured worker's employer. If you would like a copy of the new forms in advance to assist with any developmental work, please send a request to forms@wcb.ny.gov. A crosswalk of the current objection reasons on Form C8.1B and Form C8.4 to the new CARCs, as well as the scenario when the code would be used and any applicable law or regulation may be found on the board's website at wcb.ny.gov. Search for CARC codes. There are about 40 unique CARC and RARC combinations to address the vast majority of possible objections. If selecting Other Legal Objection on Form C8.1B, the payer needs to include the applicable CARC code for the objection reason. There are 4 scenarios when neither Form C8.1B nor C8.4 are not required, or are required. When the amount billed for a CPT code exceeds the amount designated by the applicable medical fee schedule, the payer pays the bill at the medical fee schedule amount. The payer reduces the amount of the bill to 12, 15, or 18 relative value units for evaluation services and modalities, as set forth in the applicable medical fee schedule. The payer reduces the amount of the bill pursuant to a contractual agreement with the provider, such as the network or PPO discount, or there is a duplicate bill. So we would now like to discuss some things you should know about workers who believe they contracted COVID-19 at the workplace. As payers in the workers' compensation system, you provide crucial benefits to both employees and employers. The employee receives the lost time and medical benefits stemming from a compensable claim, and the employer has the peace of mind knowing its insurance coverage will ensure its employees are covered. We implore you to be proactive in distributing information about how to file a COVID-19 claim. Employees should be encouraged to file a claim if they feel they contracted COVID-19 at work. You should also encourage employers to help employees file claims and remind them that it is illegal to take any disciplinary or discriminatory action against employees who file or wish to file a claim. Please review all claims carefully and timely, even if a medical report has not been received. More information on COVID-19 and workers' compensation can be found on our special COVID-19 section of the website, which is at wcb.ny.gov/COVID-19. As we continue to work on implementing improvements for payers, we're committed to increased communication with payers, such as this webinar and targeted emails. The board also has a special webpage for payers. Visit the board's website, again at wcb.ny.gov, and select the Payers link at the top of the page. We will be expanding the content on this page by creating a What Payers Need to Know briefing page that highlights key activities, much like we've done today. We also plan to continue engagement with all of our stakeholders, including payers, as the board continues its modernization efforts via the future expansion of the Onboard system. For more information on Onboard, please visit wcb.ny.gov/onboard. Resources there include a walkthrough of the registration process, video tutorials, and recorded presentations for payers. For more information on the CMS 1500 initiative, please visit wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all questions on the CMS 1500 initiative. That email address is cms1500@wcb.ny.gov. If you have payer-specific questions, you can call the helpline at 877-632-4996. You can also visit our website at wcb.ny.gov and select the Payers link at the top of the home page. You can stay informed by subscribing to get board notifications straight to your inbox at wcb.ny.gov/notify. You can also visit wcb.ny.gov and select Get WCB Notifications on the bottom of the home page. You choose the topics you'd like to subscribe to. You can also follow the board on Twitter, Facebook, Instagram, and YouTube for board news, project updates, trainings, and more. So thank you for attending this presentation on our important updates for payers. We will now take the rest of your time to answer any questions you may have. Again, I just want to reiterate, we are taking questions via chat only. And as I said earlier, I know some people probably came in late, but we will be providing you with a copy of this slide deck as well as a recorded version of this presentation. Make sure you are subscribed for email updates so you will be notified when those are available. The recorded version will be on both our website and our YouTube page. And if you go on our YouTube page now, you will see previously recorded webinars pertaining to payers, as well as our Onboard for Payer webinars as well. We are going to take a brief period of silence to review the questions that have come in currently, and we will be back with you shortly. Thank you.
So there's two questions that are both essentially related to a claim administrator, be it an insurance carrier or a TPA, contending that a prior authorization request they've received through Onboard limited release was sent to them incorrectly, and how it is that they should handle that scenario. And Onboard limited release uses all of the information it has at its disposal at the time that the prior authorization request is received to route it to who the system believes is the responsible party. And that party is required to respond. If you are a third-party administrator who formerly handled the claim, and now there's a different third-party administrator handling the claim, but you don't dispute the fact that the insurer is correct, there is still a requirement to respond. Otherwise, the system will issue an order of the chair against the insurer. If what you have is a new claim and you contend that you are not rightfully the insurance carrier, or maybe it's a duplicate, it would behoove you to controvert the case and file a denial, or you can contact the board and indicate that the claim is a duplicate and ask us to look at canceling and combining those cases, which would then be a basis for denial. In the rare circumstance where you believe that you've received a par on a case that has been ongoing for a period of time, and there is a responsible insurance carrier, and the insurance carrier labeled on the par is not who it actually is, that is something you can contact the board on, and we can give guidance on a case-by-case basis. But that should be the exception, and as we work to improve the system and payers get better about making the appropriate e-claims filings, those instances we hope will decrease continually over time. Sort of related to that, there's also a question about potentially duplicate claims being created. And again, I would encourage, if you receive a claim, if you receive a prior authorization request on what to you is a new claim that you believe to be in a duplicate of an existing claim, that you promptly notify the board so that we can make a determination and cancel or combine those cases as needed.
There's a question related to documentation that is required to be filed with the C8.1B or C8.4 if you are objecting to payment of a bill. And the new forms will be on our website on July 1st. And they do indicate that if the medical bill is not in the board's case file, that the bill should be attached to the C8.1B or the C8.4. Otherwise, there is a field on each of those forms to identify the document ID so that we can easily locate the bill that you are objecting to in our case file.
So there are a couple of comments I just want to say up front, there are a couple of comments in the list of questions in the chat that are, I would consider them enhancement requests or feature requests or suggestions for how to improve the system. We are aware that some of these things would be helpful to payers, and we welcome additional suggestions that we could consider.
There's a question regarding apportionment when submitting an objection to payment of a full bill. What I would suggest that you do now is indicate that you would be paying your portion of the bill and include that in the other category right now on the C8.1B objection reason. But we are working with X12 to hopefully come up with a new CART code in scenarios where there is an apportionment. So if and when that new CART code becomes available, we will let you know.
There's a question about perceived delays in our scanning and document upload process for eCase and how that can lead to duplicate filings. Our scanning imaging upload process is managed on a tight and well-monitored timeline where all documents should be in the case folder within 3 or 4 days of when they were received by the board, depending on the method by which they were submitted to the board. Electronic documents do get to the case folder faster than paper documents. We acknowledge that in the past 2.5 years, there have been periods where documents regularly exceeded that time frame, and we were upfront about communicating those delays and posting them on our website. We have not experienced those delays in over a year. So if anyone has specific examples of documents that are taking more than 3 or 4 days from receipt by the board to appearance in the case folder, we'd be happy to investigate those, but to our knowledge, there is no problem with delays of scanning and imaging of documents.
There was also a question regarding the grace period that Adam mentioned earlier in the presentation. So we are allowing payers to have an additional time period in order to start using the new objection forms, the C8.1B and the C8.4. Those will be those can be used starting July 1st, 2022, but they will be required to be used by September 19th, 2022. XML submission by the carriers, or I'm sorry, the clearinghouses has already started, and they will continue to do that, indefinitely. So the September 19th date relates to the C8.1B, C8.4, and also use of those new CART codes on your explanation of benefit forms.
There is a question about how much time from the onset of care is allowed for an authorized treating provider to submit an MTG confirmation PAR. And MTG confirmation PARs are optional on the provider side. So if the provider believes that something is within the guidelines, they're not required to request or obtain prior authorization. If you receive a prior authorization request for treatment that has already been rendered, the payer has the ability to administratively deny the PAR on the basis that the service has already been rendered.
I see that there's another question regarding the use of the claims adjustment reason codes, which are CART codes. Specifically, is the list finalized, or will there be any changes or additions by 7/1/2022? The list is final, and I will add, though, that there is an other category on the C8.1B. If you are objecting to, you have a legal objection to payment of the bill, and it's not specifically reflected in any of the other boxes on the form, you can select that other category and choose the most appropriate CART code from X12 that links up to that reason. We will be taking a look at those other codes that are coming in periodically and making modifications to the CART listing. But as of now, that list is final. Again, if there are additional reasons, you may select the appropriate CART code and use that field, that box 20.
There's a question about level 2 review and what the payer can do if a level 2 reviewer grants an item requested on a PAR that has been denied at level 1. And level 2 is still a payer response. So there is no mechanism for a payer to change or appeal an item that they had granted once they have granted it. If that question was referring to level 3, which is review by WCB, most often the medical director's office, there are some instances, it depends on the PAR type, where a level 3 decision by the medical director's office, the payer can request review by WCB adjudication by filing Form RFA2. But that's limited to an MTG variance PAR or an MTG special services PAR. Medications, durable medical equipment, and MTG confirmations, there is no mechanism for the payer to request adjudication review of a level 3 resolution.
All right, thanks, James. I see a question here asking which browsers are best for accessing the website. That is more of a technical question. I can say Google Chrome will work if you go to the board's website using Google Chrome. But if you are having issues accessing the board's website or any of the tools that we mentioned today, I would suggest emailing WCB customer support, all one word, at wcb.ny.gov, and they can help you with any technical issues such as that.
There's a question regarding the 4 exceptions that Adam mentioned when objecting to a medical bill. There are some scenarios where a C8.1B or a C8.4 is not necessary. And the question is, if you continue to file them, even if one of the 4 exceptions, can you continue to file even if one of the 4 exceptions is applicable? Will penalties be assessed if a C8.1B or a C8.4 objection is filed if any of the 4 noted exceptions are applicable? So, you know, our intent is to streamline and only, you know, work on necessary tasks. So our strong preference right now would be that payers not send those forms when they're unnecessary because no action needs to be taken. If that's not the case and we see that there's a lot of unnecessary forms coming in, we'll address it in the future.
There's a question about if a provider has to be authorized by the board in order to use Onboard limited release, and provider does not. They have to register with the board to use the system, but WCB authorization, particularly for out-of-state providers, is not required.
The forms, is it acceptable to list under insurer the name of the carrier, care of the TPA, and the TPA's address? So if we're talking about the C8.4 and the C8.1B, yes, the idea is to have the correct information. If there are questions related to the objection, that we can make sure that we are talking about talking to the right TPA and or insurer. So we want the most correct information on the forms in order to be able to properly resolve the issue.
There's a couple of questions about apportionment for prior authorization requests. If the provider submits a prior authorization request on whatever case they submit the PAR on, the prior authorization request will go to who the board has designated the primary insurer for that case. That is the entity that needs to respond. It is not sent to any of the apportion carriers, and responses from the apportion carriers are not required. But there also is no mechanism in Onboard limited release for an additional payer to view prior authorization requests in Onboard limited release. If you have access to the file in eCase, you can see it there, but that would be the only place where it's accessible in any of the board systems.
There's a question regarding the C8.1 form. Specifically, is it a denial or an objection? So the new form, which will be a C8.1B, is an objection, a legal objection to payment of a medical bill. One of the reasons could be that it's controverted or denied, but there are many other reasons why you may have a legal objection to payment of the bill.
There's a question about confirmation PARs that are for surgery or other, I guess, bigger ticket, more complicated procedures where the payer may want the claimant to undergo an IME exam before authorizing treatment. The time frame to respond to an MTG confirmation PAR is the 8 business days, regardless of whether the payer feels an IME or some other issue is warranted. If the payer were So saying that you need an IME or that maybe a body part is not established is not an administrative reason for denial. So the payer can deny that PAR on the basis that it hasn't justified it or that there's other medical reasons. And you can certainly note in your medical rationale that, say, a body part hasn't been established or you think that an IME is warranted, but it's still a medical rationale that's coming from your level 2 reviewer that's making that response and determination. And just following up on the confirmation PAR question we had earlier about how long the provider has to submit, it is within the payer's purview or decision-making to deny a PAR for which services have already been rendered.
There's a question regarding simultaneous filing. With regards to filing of the C8.1 and the C8.4 simultaneously, if the C8.1 issue is resolved via a notice of decision by the board, and the C8.4 issue has not been resolved by either arbitration or the medical director's office, is the carrier required to process the claim? So once the legal objection has been resolved, and let's assume that it was resolved in favor of the provider, then the carrier should pay the provider the amount that is due, taking into account any valuation objections that they timely filed on a C8.4. So they can pay the reduced amount, assuming they filed a valuation objection. And then if the provider has an issue with the amount that they were paid, they would file an HP1. And at that point, the valuation objection would be resolved.
There's a question about being able to see resolved PARs at different levels when you're a workload administrator. And I know there was an issue that has since been resolved where resolved PARs were not visible, but I would, as a workload administrator, I would make sure that I was a workload administrator for all of the PAR types and levels that I want to see. And I should then be, as long as I am a workload administrator, I should be able to see those resolved PARs. If that's still an issue for a particular user, I would contact the board's customer support unit.
All right, that seems to be all the questions we have. Our helpline, again, if you want to call that number, you can hopefully get some answers or visit our website. Again, I just want to reiterate, a recording of this webinar as well as a copy of the presentation will be available soon on our website and YouTube page. Please make sure you are subscribed for email updates so you will be notified when they are available. You can sign up to receive workers' compensation news, including information on future webinars, straight to your inbox. To sign up, visit wcb.ny.gov. Scroll down to the bottom of the homepage and select Get WCB Notifications. We also distribute information via social media, so please be sure to follow the board on Facebook, Twitter, YouTube, and Instagram. And don't forget to visit the payer-specific page on our website by visiting wcb.ny.gov and selecting Payers on the top of the page.